Did you know that almost 75% of maternal deaths that happen during the postpartum period are related to hypertensive disorder of pregnancy? And that 41% of moms dying within 2 days after delivery are due from the same condition? In this video, I will talk about the different types of hypertension during pregnancy. What are the signs and symptoms? And most importantly, what are those you should not miss? When is it necessary to call 911? Or when to call the doctor to report them? Hello parents and caregivers, this is Nurse Cherry and welcome to Mother Baby Central. This channel is all about mom's care during pregnancy and postpartum and the babies during newborn stage and first year of life. Did you know that almost 75% of maternal deaths that happen during the postpartum period are related to hypertensive disorder of pregnancy? And that 41% of moms dying within 2 days after delivery are due from the same condition? Yes, you heard me right. Hypertensive disorder of pregnancy are serious. For this same reason, I feel that this video should be shared to all, especially to our pregnant moms. Know how to be vigilant in monitoring blood pressure and watch for the danger signs, especially if at risk. First, let's talk about the different hypertensive disorder during pregnancy. Let me enumerate them and then briefly explain what they are. Number 1, chronic hypertension. Number 2, gestational hypertension. 3, preeclampsia. 4, superimposed preeclampsia. 5, eclampsia. And 6, HELP syndrome. First, chronic hypertension. Let us define what hypertension is. Hypertension is a condition where a person has elevated blood pressure. A blood pressure reading has two components, a systolic and a diastolic blood pressure. The first number you will hear after the nurse checks your blood pressure reading is the systolic, and the number after the word over is the diastolic. For example, if your blood pressure is 120 over 80, 120 is a systolic and 80 is a diastolic. Now you have hypertension if your systolic is 140 or greater, or your diastolic is 90 or greater. We're not going to talk about how the doctor is going to make the diagnosis. This video is not about how to diagnose a condition, but let us just make the assumption that you consistently have blood pressure greater than 140 over 90 over a period of time. I want to be sure we're all on the same page before moving on. If a woman becomes pregnant and has an existing hypertension, then we say she has chronic hypertension. The hypertension existed before she even became pregnant. This patient is most likely taking an antihypertensive medicine. So we just continue to monitor the blood pressure and control it, making sure the numbers do not get more elevated as she progresses in her pregnancy. This can be done through regular prenatal visits and also checking blood pressure at home and keeping a record. Next, if the pregnant woman develops hypertension after 20 weeks of gestation without any other symptoms, she has gestational hypertension. For example, a 32-year-old female came into the office for her prenatal visit at 24 weeks of gestation. The nurse checks her in, and after resting for a few minutes, her blood pressure is taken and a reading of 144 over 93 is recorded. As I mentioned earlier, we are not going to the details of how she will be diagnosed, but let us just assume that her blood pressure remains elevated after checking again for a period of time. Take note, she has no other symptoms and her blood work is all within normal limits. Our next term is probably the most commonly heard hypertensive disorder of pregnancy, called preeclampsia. A woman who has preeclampsia is the one who develops a high blood pressure after 20 weeks of gestation. So that's a common theme after 20 weeks of gestation, accompanied by the presence of protein in the urine. Now, let me make some things clear in here. A pregnant woman does not have to have protein in the urine to have preeclampsia. It can be diagnosed without it if the labs are checked as well, like the platelets, the creatinine level, liver function tests, and so on. And the results are abnormal. Or a patient is presenting with signs like a headache, symptoms in the vision like blurry vision, floaters in the eyes, flashing lights, and so on. Before we continue, friends, if you stay until the end of this video, I will share with you a bonus tip on how to modify your risk for hypertensive disorder in pregnancy. So, watch out for it. The fourth term is superimposed preeclampsia. The patient already has chronic hypertension or is already hypertensive before even becoming pregnant, but after 20 weeks of gestation develops other symptoms like protein in the urine. Labs are abnormal, like the platelets, the creatinine, uric acid, liver function tests, and so on, and shows symptoms like headache, blurry vision, epigastric pain, and others. Our number 5 term, eclampsia. If a woman has preeclampsia and then develops seizure, it could very well be just one episode of grand mal seizure or more, then she has eclampsia, given that she has no existing neurological problem like epilepsy. So the seizure with preeclampsia is a defining feature of eclampsia. And number 6, HELP syndrome. This is different from the rest because the patient can present without hypertension and no protein in the urine. HELP is an abbreviation. It means hemolysis, elevated liver enzymes, and low platelets. As you can tell, it all pertains to lab work. The diagnosis is based on the labs, and the signs and symptoms like right upper quadrant pain or epigastric pain, nausea and vomiting, and patients looking very sick are present too. Now, let's talk about the signs and symptoms. It does not matter what kind of hypertensive disorder you have. The important thing to remember is to be aware of what signs and symptoms to report promptly, even vague ones, because your provider has the expertise to investigate further and ask more questions surrounding your vague symptoms and relate it to the physical assessment, history, labs, and others. If you are still in the hospital, you don't have to worry much about reporting because the nurses will continue to monitor you and ask about these symptoms. But once you are discharged from the hospital, you need to be well versed on these dangerous signs so you know when to seek help. If you have a severe headache that feels like the worst headache of your life, difficulty of breathing, shortness of breath, chest pain, and signs of stroke like slurred speech or trouble speaking, numbness of the arms and legs, facial drooping, loss of balance and confusion, call 911 or have someone drive you to the nearest emergency facility. If you are still pregnant and you feel decreased fetal movement, call your doctor immediately or proceed to the labor and delivery unit. If you have a blood pressure machine at home and you get a reading of blood pressure greater than 160 over 110 millimeter mercury, right upper quadrant pain or epigastric pain, a nagging headache, worsening edema, hands, legs, visual disturbances like blurry vision, dizziness, flashing lights, floaters in the eyes, partial loss of vision, nausea and vomiting, call your doctor immediately. Don't wait and rest because time is of essence. Have another person be with you in times of distress, your significant other, a family member, or a friend, because sometimes these symptoms can be very serious, leading to death. So for the bonus tip, here are the steps you can do to modify your risk for getting hypertensive disorder in pregnancy. If you're thinking of becoming pregnant and you have existing conditions like chronic hypertension, diabetes, and obesity, plan on getting them under control with proper diet, exercise, and mindfulness or meditation. Some of the risk factors cannot be changed, like age, first pregnancy, history of preeclampsia, and race. So make changes in the things you can control. The stakes are high if you don't take the necessary precautions to have a healthy pregnancy. The result could be fatal to you and your unborn baby. Partner with your healthcare provider to control any chronic conditions you have and make a goal to get your health in check. And there you go, friends. Everything you need to know about hypertensive disorder in pregnancy. If you find value in our video for today, click on the like button and share it to your friend who needs it most. Be well, everyone. Make this day count and happy watching.